Hi, Lee Ankrum here from the Ankrum Institute. This is Don here, my little colored guy. And so we're going to talk about scoliosis today, but an aspect of scoliosis. You know, as we know it, scoliosis is obviously a curve of the spine from side to side. It collapses down. The spine collapses. It takes the rib cage with it. It starts torquing everything in the body. You know, there are varying degrees of scoliosis, and some people have slight scoliosis and some people have a very severe curving. So scoliosis and where it comes from. So the normal way to address scoliosis is usually some chiropractic type care in adjusting down the spine. The problem is that it slowly creeps back, the curves slowly creep back in. So from my years of education, my understanding is that scoliosis, you can have what's called functional or congenital. The congenital scoliosis is more the genetic side of something that's being passed down to you and is going that way. And then the functional side is where you use your body in a particular way, and maybe it will start to create tightness and pull one side of the spine out. So that's more something that happens over time with an overuse type syndrome. But also, so here on this skull, you can see that all the bones of the head are different colors. So my point of showing you this is that the bone of the back of the head, this blue bone is the occiput. This red bone, the sphenoid, they have a joint that comes together here in the base of your head just in front of the spine. These two bones really are very involved in scoliosis pattern. My personal opinion is that these two are the most important bones of the head, and the red bone being the most important. And it is the position or the torquing or dysfunction that's happening at the joint between these two bones that is actually, if you think about this, echoing down the spine, that is a big piece of what creates this scoliosis. And I believe that if in your scoliosis treatment, whether you're doing exercises or things like swimming and rowing are things that I believe are good for scoliosis, and some of the other ones that physical therapy gives, whatever. But this needs to have a resolution in order for it to actually go down and hold the changes that are being made by these other modalities and other treatments and other exercise. So it's a complex issue, but one that should not forget that there is a piece that's actually happening in the cranial membranes and cranial bones. So hopefully those people who are working on their scoliosis and so forth are also working with a cranial sacral practitioner. Thank you, Lee Ankrum here at the Ankrum Institute.